Okay, and away we go, Scott.
All
Hi, and
right.
good morning, everybody. My name is Eddie Matthews from the Stratford and District Chamber of Commerce, and we're thrilled to be able to present this webinar for your information today. And it's something new and it's something informative, and I hope you have some questions and want to become interactive with this. It's called Get Ready, and people around Stratford know Julia Opie, and we're going to get used to hearing from Scott Ashley as well, who's the brains behind this and has, when he explained it to us, he put it into great layman's terms, and we appreciated that. Just so uh, when you hear from the doctors and the scientists behind this, it's one thing, but to get it from Scott, he really puts it into great parameter for us. So without any further ado, from Get Ready, ladies and gentlemen, please welcome Scott Ashley. Good morning, Scott.
Well, good morning. Thanks, Eddie, for that. That's very kind. Welcome, everybody. Julie is here with me as well. So, Julie, just say hello there if you want. And
hi, Stratfordites.
Yeah, Julie was down there, and we were just talking about how much snow you guys were getting. I'm up in Midland, north of Barrie, if you know that area. So, yeah, no, this is great. And listen, I'll just give you a super quick background. I've been in emergency services for pretty well most of my life, I guess, actually. And I was a paramedic out in Alberta and then down in Los Angeles, and came back to Ontario, where I'm from, Kitchener originally, not too far from Stratford. And I worked with Toronto for a bit, and I was a critical care flight paramedic on the Orange helicopter out of Sunnybrook and Sick Kids. And, you know, it always struck me that every time we went to a car crash or a situation, you know, at a building or a school or whatever, nobody seemed to really know what to do. Nobody was really sure. They all knew they had to call 911, but they weren't really sure on what they had to do. And, you know, we got into emergency planning and doing a lot of different consulting work for, you know, the automotive and mining and airlines and banking and schools and universities and so on, and building emergency plans and procedures over the years. And it's what we try and do is separate policy from procedure. And I know, you know, if you, wherever you work, you probably have a fire plan and different policy documents and stuff like that. But our experience is no one cares about the policy when the building's on fire. They just want to know, where am I supposed to go? What am I supposed to do? And whether you're, you know, a new part-time staff person or the CEO of the company or somewhere in the middle or whatever, you know, everyone just wants to know. And what the security is doing is different than the switchboard, which is different than the staff, which is different than the manager and the director and the VP, and, you know, so on and so on. And everybody has their roles. And what we try and do is to create those roles. So we've been doing pandemic planning for many, many years. A lot of us on our team have, we got about 45 different people who come from police, fire, EMS, critical care, public health backgrounds. A lot of us worked through the SARS outbreak back in the day, and we were involved in a lot of different planning around the H5N1. For those of you that know that one or remember that, when people were buying Tamiflu and Relinda and stuff. But it really comes down to exactly what are we supposed to do. And so everyone's worst nightmare right now is, you know, somebody phones your business and says, hi, you know, it's so-and-so. I just tested positive. And you're going, oh no, now what am I going to do? And, you know, it's not what are you going to do? It's what exactly are you going to do? What do you want that person to do? What does staff have to do? Other people, you know, all the way down the line. And people are thinking about these things and wondering, okay, so what all do we have to do here? And that's really what we want to, you know, give you the sort of the tools and the skills to manage this kind of thing. So I just wanted to take a few minutes. We used to have stage 1, 2, 3. The government's now come out with this color code zone system. And really, at the end of the day, what it's done, it's based on outbreak numbers and bed, hospital, and critical care bed availability. And so as our numbers go up, the risk is that our hospitals become more, there's less beds, there's less availability as more people are sick and require medical treatment. Ultimately into an ICU and into a vented or ventilator, you know, ward like in the ICU or so on. So if too many people get sick, we're not going to have enough beds to look after everyone, and that's the problem and that's the risk. And that's why the government's doing this staged rollout, so that they can say, you know what, you're okay right now. And if the numbers go up, we're going to dial it back. And right now, Stratford is in orange in the restrict. And we can talk a little bit about that. This is sort of an open forum, so please, if you have questions or anything, jump in. But I'm going to talk about this for about 10 minutes, and then we're going to just open it up to questions, and we can look at some other stuff if people have more specific questions. You know, when we look at code red, for example, here's an example between restaurants and personal care and retail. This, by the way, is the same thing for code orange. In a retail, you have to have passive screening. So you have signage that basically says, do you have signs and symptoms? And if you do, then don't come in the building. At a restaurant, you have to have active screening, which means you need to record the name, first name, last name, and phone number of that customer. As well, everyone has to do their staff. Personal care, same thing, active screening. And so people say, well, do I need to give my name at the grocery store or at a big box type store? The answer is you do not have to. And if you're the owner or your business manager, whatever, running those businesses, then you don't need to get those people's names. However, if you're in a restaurant, if you're in personal care, if you're in a gym, you must record their name. So not only staff, but also visitors. So it's just some of the changes and some of the nuances and some of the details where it gets a little weird sometimes. All of this relates back to what is called infection prevention and control. And it's known as IPAC in healthcare. We've been doing pandemic plans for hospitals for about 15 years. And if you reach out to a hospital and ask for their IPAC manager or, you know, officer, staff, whatever, they will get you in charge of or in contact with a person who looks after communicable diseases. And how do we protect staff and patients and families and so on? Hospitals have been doing this for literally almost 100 years, since the last pandemic, really. And so you've all gone to the hospital, I'm sure, to visit somebody, maybe, you know, in the hospital, in the ICU, labor and delivery, whatever, to see a newborn or someone, you know, and that when you arrive, the hospital staff will say, you'll need to put on a mask or a gown or mask and gown or whatever before you go in and see this person, wash your hands and do this and that. And everyone goes, okay. Well, now, due to COVID, every single workplace needs an IPAC program, not just hospitals. And that's really what we try and help people do, is to put down the procedures, the training, the equipment. If you give your staff, as an employer, if you give your staff masks and hand sanitizer and make these things available to your staff, by law, you actually have to teach them then how to put on that mask and how to remove that mask. There's thousands of documents and literature in healthcare showing healthcare workers, doctors, nurses, paramedic staff becoming infected by improper use of their PPE. So, you know, you'll see people sometimes, doctors, nurses, you know, they've been trained now, so they don't typically do this. But what happens is someone goes in and you're in the grocery store or whatever, and you see someone wearing their mask, and they'll grab the mask and they'll pull it down off their face. Maybe they'll drink their coffee or whatever. And then they'll grab their mask and they'll pull it back up on their face. That's wrong. You cannot touch the fabric or the outside of your mask. You can touch the elastics, the bands that go around your ears, and take it off or put it on. The first time you can adjust it, but after that, you can't be pulling it on and off. Most people have no idea. They were given a mask and they just do the best they know how to do. So this is what IPAC's all about. What's happening in Ontario and, you know, across the country, but what we're worrying about right here is what's going on here is our numbers are going up. We're in the second wave. Our numbers are climbing every day. I'm sure you've seen this on the news and heard and talking to people. And the problem is, if you had a person become infected or test positive at work, who else have they come in contact with? What other workers, what other customers, their family members? And it's called contact tracing. And public health, their job is to chase down these people, contact them all, and get them to isolate or quarantine so that they don't spread this and make this a worse outbreak. The problem is taking 3 extra days because the companies, the businesses, they don't have the contact information. So So what they did on September 25th is they passed a law. They made an amendment to an existing law that now requires all workplaces to track and screen their staff every single day. And so we know who, from a staff perspective, who was there, what time they got there, if they were healthy, if they were not healthy, if they were not able to come to work or whatever. It also tracks any customers who may need to be tracked or essential visitors, contractors, support workers, vendors, people like that. So what we did, and this was back in March, is we developed a daily screening tool as part of our overall platform. And so we've had companies using this for months, where literally we take all the people. So if your business has 20 staff, we would take first name, last name, email. If you have multiple sites, we take the site A, B, C, whatever, and departments, and the role, staff or manager. Very simple. It's an Excel sheet. We upload it into our system. Everyone is onboarded, and they're sent a link, and they can put this app onto their phone, or they can access it on their desktop or laptop device or whatever. And if you have some staff, and there's always the question, well, what if my staff person doesn't have a smartphone? Well, then fine. Then they can call their boss, or they can do it on a computer from home or something, or they can just phone someone at work and say, hey, can you fill this out for me? So it's very possible. But it's a quick little tool. It takes about a minute. They install it. They click on the icon. The app opens up. Answer these questions. Put in your contact information. There's a question down here about your affiliation with the company. Are you a contractor, staff, a vendor, customer, whatever? And you click submit. When you do that, the managers can now see by department or by site or just by names or whatever. They can see who's fine, who's sick, who's not coming in today, who didn't pass. They can sort it by vendors. They could look and see how many contractors were here. And here's the problem. So, Scott, I phone in sick today and I say, I just tested positive. I can't come in. And they'll say, well, when were you here? Well, I was here on Thursday and Friday last week and Monday, this week and so on. Who else was here last week? And everyone's like, I can't remember who. You need to keep these records. You need to have this tracking information because this is what public health. And so with the app, you can print off a report, send it to public health, and they instantly have the names and phone numbers of everybody. And they will now start to contact and say, this is public health. You either need to stay at home or go get tested or you're fine or whatever. And they will make that determination and work with all the various people. The problem is public health doesn't have the information. That's why the daily screening process got put into place. So at the end of the day, that's really kind of what this is about. We have a whole cloud-based platform with procedures and medical directives and the communications and stuff like that. But I think what's really important is I just wanted to explain why this daily screening process was a big deal, what makes it so important for people to get it right and to be able to collect this information. And hopefully people can do it in a very, we track it with a lot of the businesses and they will literally save hundreds of hours every month because they're not writing stuff down. They're not transferring. They're not sharing pens and paper and binders. They're not sorting through emails and voice messages and things like that. So, it just becomes much more organized and efficient. We charge, just so you know, because the price will always be an issue. We charge $1.99 per staff person per month. And so that gives everyone in the company access to the app. There's no additional fees to any contractors or customers, visitors who are coming on site. It's just part of the app. They can use that. We have a URL link that can be sent to visitors or a QR code that can be posted so people can just click on it before they came into a restaurant or before a contractor arrived to do some work. They can be sent that link in an email or whatever, fill it out ahead of time so that when they arrive, they've actually got the data be on site or not. We also have a 30-minute infectious disease outbreak program. An online course. They watch a series of videos. They answer the quiz. This course is around the training. According to WSIB, if you give staff safety equipment, you must teach them how to use it. And so this program is compliant with that. It also talks about some of the definitions and terminology so people understand what incubation period is and contagious and what's the difference between isolation and quarantining and things like that. So they go, okay, I get it now. And they understand the relevance, how diseases are transmitted. Why am I wearing a mask, and why, is it a two-way mask, or does it protect us both ways? There's lots of questions around airborne and aerosol and not just droplet-based transmission. Things like that are answered in the quiz. It makes them compliant with WSIB. So the goal with this program is the employer is compliant and the employees are safe and customers feel confident to come and see it. So anyways, I'm gonna flip it from there and go to questions and answers. Does anybody have any questions, or Jennifer, is there any in the chat?
Yeah, Scott, there was a question. Is the information compiled safe, and is it shared to any third party?
Yes. So first of all of our personal information, we gather from clients is not shared with anybody. It can ultimately be shared with public health. It's no more than your contact information. We're not asking in these if you have a fever, a cough, a cold. We're asking if you are fit to come to work. You answer the questions yourself. And if you answer yes to any of those, then just like you would at a grocery store or on a poster, you say, yeah, I can go to work or I can't. What they want is your first name, last name, and your phone number. And that's the information. That's what if you go into McDonald's, they will write down your first name, last name, and your phone number. If you go into restaurants, that's what they're going to do. This does the same thing. The real privacy issue comes around the treatment or diagnosis of medical information, and we're not collecting information and we're not providing a diagnosis or treatment. So it's very clean, and we work with some of the biggest organizations and most heavily unionized groups, and it's passed all of their requirements.
So another question, is that the only question on the app? Are you fit to come to work? No, that's not the only question on the app.
No, we want your name. If you're not a staff person, we want your affiliation with the company so we can filter it by staff, by contractors, visitors, so on. There are questions, but their only answers are you fit to come to work, yes or no? So there would be a series of questions. Do you have a fever? Do you have a cough, shortness of breath, loss of smell or taste sensation? There's about 8 of those questions, I believe, but they are only questions posted with the final answer being you are fit to come to work. And it says, if you've answered yes to any of the above, then you're not fit to come to work. Are you fit to come to work? Yes or no? That's what we're getting. So your name, your number, if you're not a staff person, because if you are a staff person, we have your phone number, or the employer has your phone number. Otherwise, it's your affiliation, your name, and are you fit to come to work? Automatically dates and time stamps it. So it allows the employer to go back and look by date, by site, by department, and see who may have been exposed so that they can rapidly provide this information to public health. Otherwise, public health, it takes them 3 days longer. And by then we now have 50 people that have been exposed instead of 5. And we've compromised our healthcare and our community. And that's the whole reason for this program.
So there's 3 more questions. One question is, are there contracts with this app? Can you stop using it any time?
Absolutely. There is no, you pay for it monthly. You can stop at any time. You simply click on the link. So if the chamber was to send you a link, which I'm sure they have, or introduce the program, when you click on that link, it takes you to our shopping cart. You pick the number of staff. The minimum is 10. You pick the number of staff that you're buying it for. So if you have 20 people, you just scroll it to 20, and it's $1.99 per person per month. So it would be, $39 or whatever. And then you pay that. We send you a receipt and we send you an Excel sheet that you need to fill out and send back to us so you can be onboarded. Typically takes 24 hours by the time you get the mail and we get it back and so on. And then every one of your staff is sent an email to create their own password and then go in and download the app. You decide at the end of the month, that's it. Or if you want to run it for 3 months or 6 months or whatever, that's your choice.
Yeah,
Hopefully
so
that.
tying in with this is after discussing pricing for staff members, you mentioned contractors or visitors. Can you clarify if they use this as well, and is there an additional cost?
Yeah, no, for sure. So you only pay for staff. So if you have 20 staff, then you'll pay that $1.99 per staff person per month. If you have customers like in a restaurant, or if you had contractors, electricians coming in, plumbers, whatever, contractors, you know, to do any renovations or whatever, anyone coming on site has to be screened. There is no cost to any of those people. You have a link that you can send them, or we can have a QR code made and there's that posted at the door, or we can put it on your website, or your web person can put that on your website. So any visitors, customers, contractors coming to the site, they simply click on the URL, it opens up the app, and I would go, Scott, Ashley, contractor, here's my phone number, affiliation, contractor, date and time, and I hit submit. And just to be clear, the owner would then see this, the managers would see this on their phone or on, so they could filter and they could see all the staff, they could see any contractors, they can go back date and time. So just to be clear, there's no cost to additional people beyond your own staff, and they can be sent a link that they can fill out the app prior to arriving at the workplace.
Teresa has a question. Is the information stored for a certain amount of time? So I believe it's
yes.
Is it 7 years?
Yeah, we typically store all records, even training records. We have that information. And just while we're talking about the training, so we do keep that record. We do keep that information for 7 years. With the training records, if your staff would have access to the online training. Customers and contractors would not have access to the online course. Your staff can print off a PDF certificate, a copy of their certificate, or you can keep it digitally, or if the Ministry of Labor comes in to see if you've done staff training, you can demonstrate and be able to show them all the certifications and the completion dates and times of all your staff. That's part of it. And that stays on. If the contract gets closed, we have 3 levels in our learning management system. We have active learners, we have deactivated learners, and we have archived learners. So if you had a seasonal company and you had 10 employees over the winter and you hired 20 or 30 people, for the summer months or whatever, while they're away, they may be deactivated, and then when they come back in the spring or whatever, they can be activated again. If those people left, retired, or were students and never came back or whatever, then that information goes into an archive database.
Okay, that's all for questions at this point. Teresa said, sounds great. Kate said, perfect.
I think it's great. I think you will find it saves a lot of time. It saves a lot of grief, and you'll see, and your staff will see that, when they fill this out, they can see that we're not asking for all of these things. We're not asking for their information. We really need their first name, last name. For all your employees, you have their email and you have their phone number, and we just want to make sure we're collecting the emails and phone numbers of visitors and contractors who are coming on site.
I actually think it's probably safer to have it in a digital way, because you can see in some places that you go into, they have a pad of paper or a book where you're writing names of people and phone numbers, and then they leave it as they go to seat that person at a restaurant, and that information is just sitting there. So,
well, from an information perspective, for sure it is, and then from a COVID perspective, nobody wants to use the pen the last person just had, right. touch the binder, touch the notepad or the piece of paper, and it's things like that. So it's much easier, even at a reception desk for a business or a doctor's office or a real estate office or whatever. You could send the link to people ahead of time. You could send it to patients who must fill out the form. But you could also just have reception do it when they walk in the building. hi, before you sit down, you know, ding, 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 asking those questions. They could be typing in the information right at their own reception desk computer, and nobody touches anything. So there's a number of ways to roll this out and deploy it. But at the end of the day, the goal is hopefully it takes less than a minute and it's simple. And if something does go wrong, you have the information at your fingertips.
So Eli's asking if someone's on holidays, how does that show in the app? And I think it's important to note that only if you're going into the workplace do you need to fill out that form. If you're not going into the workplace, you don't have to fill it out.
Correct. So we don't need you, you know, if you were either on vacation and not coming in at all, or you were out of town, or you tripped and sprained your ankle and you're not coming in, that means you're working from home. Or you're sick, or you're on sick time, or whatever. So we don't need to track that. Yeah. Julia, that's correct.
Okay, question. If there is a vaccine brought out in 2021, will this still be relevant?
Yep. So it's interesting to see the number of conversations we've had. Our medical director used to be the chief safety officer for University Health Networks in Toronto General. It's Dr. Michael Critchin is his name, and he's currently the medical director for the air ambulance program in the UK, based in London, England. Mike's an emerg doc and a thoracic surgeon and has a master's in public health crisis. So he's very switched on, and it's interesting to get the different perspectives of what's happening in England, in the UK, and in the EU, versus what's happening sort of here in North America. Just to be clear from what our understanding is right now of how this vaccine or different vaccines from different manufacturers may be deployed, it will take about a year to vaccinate all of Canada's population. The first few months will be the critical people that need to be vaccinated. For example, our military, our government officials at municipal, provincial, and federal levels, our police, fire, EMS, obviously healthcare, education, teachers, you know, those kinds of, all the critical infrastructure, Ontario Hydro and utilities. All of those organizations and their staff and people will have to be vaccinated first. And this is a 2-vaccine process, 2-shot over a 3-week period. So the scheduling and logistics is heavy. And you've probably seen that some of these, there's different manufacturers have different types of vaccines that they've produced. I forget who was which, but Pfizer was saying they need to keep it at, a very cold temperature and will require refrigeration and so on. So things like that just add the complexity of trying to bring around vaccine in, April, May, June, July, August. That's one. So it'll take some time. So probably before this gets out to the general public and the typical sort of average non-essential business or non-military, hydro sort of related service healthcare, it'll be months before people get this vaccine. The second thing is, we're not sure if you're vaccinated, if you still couldn't be shedding the virus, even though you may not get sick from the virus. So that's an issue. And the third issue is the virus continues to morph. So people who did get COVID are getting it again. And so if you're vaccinated against a particular strand, this is very similar to the seasonal flu. You might have had a flu vaccine last year, but you need it again this year because the strains of flu are different. And that's what seems to be the case, although it's not 100% clear, what's happening with the virus, although the indications are seeming that it does switch. So, this is actually going to be with us for a while, the whole COVID thing. It's going to probably require screening for some period of time and proper hand hygiene and proper social distancing and physical distancing that people talk about. So the vaccine is as great as it is. It's not, as Dr. Tam said, this is probably not going to be the silver bullet that everyone's hoping for. But it's definitely a step in the right direction.
So we have a question, just wanted to double check for visitors in a retail setting, is it just a name and phone number that we would get from them to enter into the system, or do we need their email too?
They would enter their email because they are sent a copy of the form that they filled in. So they have a record that says, hey, Scott, check mark, you're fit to go to work, and the date and the time. So they have a record of that, and the employer, the company who they're filling it out for, you would see that on your dashboard as well.
Eli's asking, is there start times linked for different shifts?
So the rule is, the guideline that we try to get every company to do is people have to fill in the app within 2 hours of their arrival time. So if you had, say, a retirement home or a hospital or whatever, where maybe people are working from 12-hour shifts, maybe they're working from 7 a.m. till 7 p.m. and then night shifts coming on, at 7 o'clock at night, they would be asked to fill it out for the day shift, between 5 a.m. and 7 a.m. And for the night shift, they would be asked to fill it out. And then we typically look at that timeline as being valid, for the next 12 hours.
Perfect, thanks. Okay, the question above was whether visitors have to give their email.
They do have to, because they have to be sent a copy of what they filled out. So they have a record of it, and the company may need it because ultimately the public health may need it. But we ultimately need it just to go to our system. Without that email, it's not going to integrate into it.
They'll basically, when they complete it and click submit, they will receive either a pass or a fail. So a pass is a yes and a fail is a no. And that will show up on their, they'll get an email that shows that up, and then they can show that to the restaurant as they walk in, or
Yep.
That workplace as they walk in. So that an email address is needed in order to receive that pass or fail.
Yeah, and it's interesting, everyone. When we first did these and first rolled this out, we didn't do that. We only had it set up for staff. We didn't have it set up for visitors or contractors or whatever, non-staff people. And when that became a factor, we started to roll that out with some of the larger clients that are doing some major projects and have a lot of people coming and going who are not staff. The people wanted a copy of what was submitted. They didn't wanted to have a reference themselves, and that's why the email got added in there, so that they could see it themselves.
Right. Question, do staff say what time they left work, or is it just an entry for what time they started?
It's just an entry.
Yeah, for what time they started.
Yeah, it's just screening to enter the building. Hopefully they're there for a regular shift, and we have procedures around if people are working longer. If they ended up working a double shift, they may have to. We would recommend that they would refill out that screening for the second shift.
Okay.
Most people haven't really had a problem with that, but that's a guideline. So.
If multiple places have this app, will it carry over to the next place? So just to clarify, Eli, do you mean if you have several plants in a town, or I'm just trying to figure out exactly what you mean there. If multiple places have this app, will it carry over? I just need to clarify whether it's the same company with different locations within the same area. Or are you talking about if Joe's restaurant has it, and
if you went to 2 or 3 restaurants one evening, if you went to one place for a drink and then you went down the road for your main course or whatever, and then you went over to a dessert place at the end of the day or whatever, those restaurants or those establishments, those businesses would not be integrated. They're not linked, and you would fill out the screening at each location before you entered that business. If you have multiple sites for your own company and you filled it in to say, okay, I'm out at the warehouse right now as an example, or site A, then if you were driving from there and going to site B and they wanted to see it, they could do a search. You would have the copy on your phone, and the people at site B could go on to the admin page here, the dashboard, and see that you've already filled it out. They could search you by name or by site or by department, by date and time, and they could see that you filled one out 2 hours ago for site A, and you're fine for site B. Hopefully that answers your question.
Interesting question. Yeah, he said yes, that answers that.
Okay.
Hillary's asking, for the pharmacy world, a lot of our customers may fail because they're coming in, for example, for Tylenol or a fever. Is there any way for us to just document their name, phone number, and time they were in the store, or the email is a mandatory field to enter the information?
So we would have to look at the specifics of if they had to do specific COVID screening like they do in restaurants, or if it would be more considered a retail and have to do the non-specific screening.
Yeah, because when you walk into a Shoppers Drug Mart, there isn't somebody standing there asking you these questions.
You don't. It's like going into a Canadian Tire or a Loblaws or Home Depot. There's just the questions. If you answer yes, then technically you should say, I'm not fit to come in this building. I'm sick. I'm not going to go in. And I think Shoppers would fall into that same. My experience is they do. I was there the other day and no one was taking my name. If
but
that changes,
smaller pharmacy we're talking about.
Okay. I don't think a smaller pharmacy has to take your name.
I don't think so either. Hillary, maybe you can answer that. This is an opportunity for delivery. If somebody has COVID symptoms, they shouldn't be leaving their house. And that's the thing. There's obviously you have a fever because you have an infection. That's a different story altogether. So there's a series of questions. I guess the thing is, Hillary said, I believe we fall under the retail category. So right. Yeah, that is a tricky one. And people have to be honest. And that's bottom line. What this comes down to is that people are being honest with their answers. So yes, you want to go out for lunch or you want to go shopping, but if you're not really feeling 100%, should you really be doing that?
So it's an interesting dilemma because we really hope that people are honest and filling out the information or answering the questions accurately. The other thing that's a huge factor is what's called the asymptomatic patient. And asymptomatic means without symptoms. So a symptomatic person is someone who has a fever, a cough, shortness of breath, loss of smell, headaches, body aches, things like that. An asymptomatic person feels fine. They have no signs and symptoms. They feel normal. They feel they're fine. The problem is they still may be shedding virus. They still may be contagious. And so even though, and this is why all of this COVID is not about one part of it. It's not about just the screening or just wearing a mask, hand sanitizer. It's about every single piece of it. And it's like spokes in a wheel. The more spokes you have, the stronger the wheel. If you only have screening and not physical distancing and not wearing masks, obviously people are at much greater risk. So when you look at a program, you look at it from really start to finish, you look at it in its entirety. And if you have proper screening in place and proper physical distancing and proper hand hygiene and wearing masks and putting up physical barriers or plexiglass or things like that where you can't have that 2-meter distance. If you have people taking their turn and being patient and waiting in line and not being too close, all of these things are what makes a safer, environment for everyone. And so, it's all part and parcel of doing it right. Does that make sense?
Yeah, and the countries that have succeeded are the countries where the people listened to their government and they wore the masks, they stayed home, they did exactly what the government has asked them to do. But in other countries, it's not always the case.
Well, this is a real disease, everyone. And, we still hear people from time to time saying, oh, this is, you know, this is all propaganda, it's not real. No, this is very real. I can assure you that people are getting sick, they are dying. And you know, what's shocking is, and what they don't typically talk about, it's just like they do on long weekends. You know, you'll hear at the end of a long weekend in July or Labor Day or May 2-4 weekend or whatever, you'll hear people say, oh, this weekend, you know, 15 people were killed on Ontario roads. What they don't talk about is the 150 people that are in the ICU with broken legs and broken backs and broken necks and head injuries and internal injuries. People who became, you know, paraplegics and quadriplegics. Don't talk about those people. And the same thing with the COVID now. They're not talking about the people that have, you know, internal organ failure and liver and brain and other problems because they've been on ventilators, because their body's been compromised. So, you know, this is, you know, in the States, over 250,000 people have already died. Well, how many people are sick and will have debilitating injuries? You know, in Canada, we have over 10,000 people now, I think the number is. It's a big deal. So it is important for everyone to be patient, to wear their masks, and to, you know, follow the rules around proper physical distancing. You know, it's interesting as we work with organizations and the public and everyone, you know, it's interesting how terminology changes. You know, for those of you that'll remember back into March and April, we called it social distancing. And that's when we learned not to shake hands and not to give people a hug. In other words, not to come in contact. Then it moved to physical distancing. So when we all learned we can't shake hands anymore, we can't do some of these things, but sometimes we were still too close, it shifted to what's known as physical distancing. And therefore everyone goes, oh no, hang on, you're a little too close. I'm not going to shake your hand for sure, because I already learned that skill. But now I'm going to make sure that we're at least, you know, 6 feet apart. So, you know, in the grocery stores and LCBO and retail outlets and stuff, that's why you're seeing this plexiglass that's now keeping people away from the cashier, at least, you know, if they can't be more than 6 feet or 2 meters. Now there's a big plexiglass piece there, not just a little flimsy piece. So it's taken time to evolve and get people to learn and understand. Does that make sense? Hopefully I'm answering your questions. Sometimes I ramble on a bit.
I don't see any other questions at this point.
Well, listen, we have a team that's ready to help. We're working, we're very happy to be working with, but we're working with the chamber and its members and non-members to get this information out into the community, make it simple, make it affordable, make it easy to deploy, and go from there. So I thank you, everybody, for your time and your interest. And Eddie, I'll stop talking and pass it back to you here.
Yeah, thanks. You did a nice job explaining that. And folks, if you have any other questions, you can certainly give Scott a call. We've got a link up on our website to get a hold of Scott. Julie is always available to answer any questions as well. And we'll post any information that comes out from Scott and from Get Ready. We'll make sure you find out about it as well. Okay, Scott, thank you for this, and I hope we get to talk again soon. Okay.
Well, it's our pleasure, and thank you very much for having us, and thank you, Jennifer, and thanks everybody. So take care and good luck, and we're around if you need us.
Yeah, thank you.
Wonderful. Thanks everybody. Have a great day today, and like Rocco Rossi and they've said, the key phrase to use now is stay positive, test negative. That's the whole way to look at it.
Oh,
thanks everybody. Have a great day today.
Okay, we'll see ya. Thanks, Eddie and Jennifer.